Hi, everyone. Welcome to Trusted Messengers and Trusted Spaces, engaging arts and culture for vaccine competence in your community. I'm your host, Sunil Iyengar, Director of Research and Analysis at the National Endowment for the Arts. And now it gives me great pleasure to introduce colleagues at the Centers for Disease Control and Prevention and at the National Endowment for the Arts, where I work. You'll first hear from some remarks by Dr. Dimitri Daskalakis, who is COVID-19 Deputy Incident Manager and Director of the Division of HIV/AIDS Prevention at the CDC. Then you'll hear from my own colleague, Rod Joy, Chief of Staff at the NEA. It's exciting to be able to feature both agencies on the same platform. Here they are now.
Hi, everyone. My name is Dr. Dimitri Daskalakis, and I'm the Deputy Incident Manager on CDC's COVID-19 Emergency Response, and by day, the Director of CDC's Division of HIV/AIDS Prevention. I'd like to start by thanking my colleagues at the University of Florida Center for Arts and Medicine for inviting me to speak today. This webinar comes at a critical moment in the COVID-19 response. Cases are once again rising in the United States due to the even more contagious Delta variant. Despite this, vaccine confidence and uptake continues to remain low in some communities. CDC is working with a variety of partners within health systems and at the community level on COVID-19 vaccination efforts. Engaging the arts community is one of the many creative strategies being utilized by CDC to promote COVID-19 vaccine confidence and, importantly, increase uptake. So we know that local artists bring specific expertise that can help strengthen health messages by making them more acceptable, accessible, and frankly, memorable. Local artists can also play a really important role in delivering fact-based information as trusted messengers, within their communities. There's a long history of leveraging arts and culture to promote healthy behaviors and specifically vaccine uptake in the United States and globally. Thoughtfully designed and culturally relevant content have long been used to support healthy behaviors in other areas of health too. And I'll give an example from my own experience when I used to be the head of the Bureau of HIV in New York City. And I used artists like Keith Haring and Mark Jacobs to create a safer sex kit that not only was exciting, but also told the story of new strategies of combination HIV prevention. We called it the Pleasure Kit. So I am no stranger to really harnessing the arts to be able to make really clear and strong public health messaging. Our Vaccinate with Confidence framework guides us on how we promote uptake of COVID-19 vaccines, which includes the strategy of engaging communities in a sustainable, equitable, and inclusive way, using two-way communication to listen, build trust, and increase collaboration. Arts and culture bearers can also help us with the following tactics. By empowering vaccine recipients to share their personal stories, they are our messengers and reason for vaccination within their circles of influence. Working with health departments and national partners to engage communities around vaccine confidence and service delivery strategies, including an adaptation of vaccine sites to really meet community needs, and collaborating with other trusted messengers, such as faith-based and community leaders or other artists to tailor and share culturally relevant messages and materials with diverse communities. I'm excited to say that today CDC is partnering with arts and culture organizations to promote COVID-19 vaccine confidence and demand by supporting funding for arts-based vaccine confidence partnerships for projects in partnership with our health departments, and that's coming soon in late August. We have created a set of informational field guides about how to foster public health partnerships and implement programs with arts and culture organizations, and that's available on our CDC website. And in our backyard, a pilot project here in Atlanta to demonstrate how arts and culture can empower vaccine confidence. We're going to hear a lot more about that today. So I want to close by saying that this is a truly unique opportunity to work together as a whole of government to demonstrate the power and potential of the arts as a public health strategy. I'm excited to see what comes out of this important work in the months ahead. Building vaccine confidence takes time because it's based on building trust within communities, but it is achievable. Strong confidence in COVID-19 vaccines within communities leads to more people getting vaccinated, which will ultimately help stop this unprecedented pandemic. I want to thank you all for your time and for all that you're doing to protect the health of our communities. Thank you very much.
Hello, everybody. My name is Rod Joy. I serve as Chief of Staff at the National Endowment for the Arts, and I am honored, and our agency is honored, to help welcome you to today's session on engaging arts and culture for vaccine confidence in your community. At a time of enormous consequence for our country, and at a time when we all need what art brings us, we appreciate you making time to participate in today's interactive session. I'd like to start by thanking all of our partners for this event: the Center for Disease Control and Prevention, the Center for Disease Control Foundation, and the University of Florida Center for Arts and Medicine. We're profoundly grateful for your partnership and spirit of collaboration. If COVID-19 has taught us anything, it's that people around the country and across the globe are interconnected in a myriad of ways. What happens anywhere affects all of us everywhere, and no one has been left unaffected by this pandemic. To truly defeat COVID-19, we have to draw upon this spirit of interconnection and interdependence. And I'd like to thank all of our partners for building an interconnected network of practitioners and policymakers across the federal family and at all levels of government. The National Endowment for the Arts is proud to maintain a portfolio of initiatives at the intersection of arts, healing, and public health. We know that our artists and cultural organizations have an essential role to play in ushering in a healthier and more hopeful future for our nation. Recognizing that trust is the currency of public health, we're thankful to our partners for tapping into the role that artists and cultural organizations play as trusted voices and trusted spaces in their community. There are a few things we hope you take away from today's session. We hope you learn more about arts-fueled initiatives that are helping to build vaccine confidence in communities hardest hit by COVID-19 from across the country. We want to lift up the public health benefits of partnering with artists, culture bearers, and cultural organizations in your community. And most importantly, we want to highlight new resources and new tools to help animate arts and public health projects at this urgent time. We hope you enjoy today's session, and we encourage you to view the Arts Endowment as a ready resource, not just today, but every day. Thank you all.
Thank you, Dimitri and Ra. Well, as I said at the outset, I'm Sunil Iyengar, and I lead research for the Arts Endowment, where we conduct, commission, and otherwise support studies about the value and impact of the arts. In recent years, it's been inspiring to see a range of empirical evidence come in, showing how the arts can contribute tangibly to public health outcomes. In studies we've sponsored, we've seen arts participation linked with healthy aging, arts therapies used to treat chronic pain, cognitive impairment, and substance abuse disorders, and arts-based strategies to build social cohesion and greater health equity within communities. I want to recognize in particular the team at University of Florida's Center for Arts and Medicine, directed by Jill Sankey, from whom we'll be hearing later. Jill co-directs the Epi Arts Lab, an official NEA research lab that is teaming with University College London to analyze arts and health variables in longitudinal data sets to better understand the role of arts participation in population health. Previously, Jill and her colleagues created, with support from Art Place America, an evidence-based framework for considering arts and culture in public health, and many other tools and resources on their website. All this research was well underway before the pandemic, but with COVID-19, whether we're messaging about masks or tests, and now about vaccine confidence, greater sensitivity to social cultural factors such as cultural traditions, and yes, the arts have become a central requirement. Which brings us to why we're here today and what we hope to get out of our time together. Let's start things off with Elizabeth Wilhelm to give us some background about the task force that started this initiative, bringing arts and culture to respond to an urgent public health and safety need. Liz is Health Communications Specialist for CDC's immunization team in the Global Immunization Division. That's her day job. She's currently also co-lead of the Vaccine Confidence and Demand team on the COVID-19 Vaccine Task Force. Liz?
Thank you so much, Sunil. It's a real honor and a privilege to speak with you all today. So as Sunil mentioned, I've been leading the Vaccine Confidence and Demand team, which was stood up in October of 2020 on the COVID-19 task force at CDC. And since then, we've worked to support states, jurisdictions, and tribal partners to build vaccine confidence. And before we really talk about vaccine confidence in depth today, I really want to define what that means. Vaccine confidence is the trust in the vaccine, the vaccinator, and the system that it comes from. And we have a lot more to do still to build trust in all three levels. But what I can say is that artists and culture bearers are integral to their communities and they're trusted. It only makes sense to partner with them to equip people and communities with the information they need to protect themselves and families from COVID-19. I've worked globally in immunization for many, many years. We never dreamed to launch an immunization campaign without songs, dances, comedy, drama, art. In fact, COVID-19 vaccine introductions are happening all over the world right now with cultural collaborations. Why would we be any different in the United States? And not surprisingly, artists are way ahead of the public health curve, and you'll hear from some of them today. We are lucky that we found kindred souls in the NEA, the University of Florida, the Georgia Department of Public Health, CDC Foundation, CORE, and two local arts groups who've made a small Atlanta-based arts pilot come to life, Dash and Living Walls. Working with all of you has allowed us to be greater than the sum of our parts. This webinar is an opportunity to learn from some of these pioneers and hopefully inspire more health departments to partner with artists, because together we can make vaccine confidence visible and build a better health system that serves everyone. Thank you.
Thank you, Liz. With that, let me just go over the aims of this webinar and cover some logistics. Today, we'll learn about 3 public health plus arts and culture programs designed to increase vaccine confidence and demand. They are the Atlanta Arts Pilot, Hip Hop Public Health, and San Francisco Creative Corps. These are programs that really extend beyond vaccine confidence to address other public health issues as well. We'll articulate why partnering with artists, culture bearers, and arts organizations is critical to vaccine confidence efforts in American communities right now. And we'll explore how these partnerships and programs were developed and what outcomes they are producing. Among other key takeaways from this webinar, we'll highlight new resources intended to enable public health plus arts and culture partnerships and community-based programs and communication campaigns. But next, I'll moderate a discussion among representatives from those programs. Along with this discussion, we'll have a moderated chat running throughout the session. The chat will be monitored by Natalie Rella from Florida's Center for Arts and Medicine. You can post questions there at any time, and Natalie or others will answer them. In addition to posting questions, we encourage you to use the chat to share your comments and to connect with one another. Also, if you would like to enable the closed captions option, that's there on your screen, I think at the bottom of your Zoom viewer. And you just have to have your Zoom player updated to enact that. So thank you very much. Let's bring our distinguished panelists on board. First, let's have Louise Shaw, curator of the David J. Sensor CDC Museum. We'll also bring Dr. Alajidi Williams, professor and chief of staff of neurology and associate dean of community research at Columbia University, but particularly apt for our purposes today, the founder of Hip Hop Public Health. And let's bring on Monica Campana, the co-founder and executive director of the Atlanta-based organization Living Walls, whose mission is to create intentional, thought-provoking public art to inspire social change and activate public spaces. She's joined by Anna Akpele, the curator of Living Walls. And then finally, Deborah Cullinan, the CEO of Yerba Buena Center for the Arts in San Francisco, whose mission, I love this, is to generate culture that moves people. Deborah is also on California Governor Gavin Newsom's Jobs and Business Recovery Task Force. Thank you all for being here. I'd like to invite each of you just to say a word or two about the work of your respective organizations first. Louise?
Hi, I'm Louise Shaw. I'm the curator of the David J. Sensor CDC Museum, where we collect and preserve and present the history of CDC and also develop projects that look at the intersections of public health and culture in order to engage people in the importance of public health to their lives.
Excellent. How about you, Monica?
Hi, I'm Monica Campana. I'm the co-founder and executive director for Living Walls. And like it was mentioned before, we create intentional and thought-provoking public art that inspires social change. and activates public spaces. And more specifically, we do murals. We are an all female-led organization, and in our mission, we focus to create spaces for underrepresented voices in our public space.
Great. And is Anne here? I don't see her on my screen, perhaps.
Yes, I'm here.
Oh, sorry, there you are.
Yeah.
I had to adjust my options. Thank you, Anne.
I'm Anna Akpelli. I was brought on this project by Living Walls, and I'm a local arts curator.
Great. Jide?
Hi, yes, I'm Dr. Jide Williams. I'm the founder of Hip Hop Public Health. And this is an organization that I founded about 15 years ago with Dougie Fresh to really help bridge the health literacy disparities that we see in this country and do it through music and hip hop culture.
Great. And Deborah?
Thank you. I'm so glad to be here. Again, I am the CEO of Yerba Buena Center for the Arts in San Francisco, and we are really reimagining the role of a contemporary art center in the life of its community. We're driven by the belief that communities are the best designers of their own systems and structures, and we are centering artists who are working to advance equity, health, and well-being in their communities. And again, very glad to be here.
Great. Well, like I said, I'm excited that we can share a screen today. Before we get into some discussion, let's watch a short clip to get to see some of the work you've all been involved in. Thank you very much. That was really amazing. I actually wanted to also call out at the beginning, for those of you who signed in early, you probably saw some great PSAs using the arts and rap, particularly in music, to message about vaccine confidence. And I thought those were great examples to sort of enliven the panel discussion itself. So thank you. So let's start the conversation. I wanted to ask about the Atlanta Pilot Project, which is a partnership, as was said, between CDC and two local arts organizations, Living Walls, and Dashboard. Louise, can you start us out? How did that project come to be?
Sure.
And who all has been involved?
Yeah, our journey started back in February of 2020 when we got approached by the CDC Vaccine Confidence Task Force to try to see whether we could make some links with some national organizations, including the AAM, the Alliance for American Museums, the Association of Science and Technology Centers. And that, just from that initial inquiry, whether we had any contacts, has evolved this sort of amazing project that is bearing a lot of fruits. It being the federal government, it has taken a while for all these projects to evolve and get off the ground. I'm glad to say that Aztec and AAM is actually giving out some micro grants, and that application is due September 2nd. But at any rate, back in late spring, I said, listen, we need to get off the dime here, and why don't we try to do some demonstration projects in our very own backyard here in Atlanta. It's a little bit out of the box for CDC to be doing this, but I suggested to arts organizations that are extremely experienced in working in the public sphere. One of them, of course, is Living Walls, and I'll let them speak more about their project. They're very well known in the community and are responsible for so many of the incredible street art we have around here. But the other one is an organization called Dashboard that does very innovative public art projects that often uses technology. So they came up with an idea about doing commissioning a tech spec text-based project by an artist named Nikita Gale, who grew up in Atlanta. She lives in LA now. That was a messaging about thanking people for getting vaccinated. I mean, what's really interesting when you do projects like this, the context of what this was happening evolved. And when we started out, we thought it was going to be more of a celebration. Of course, the Delta variant has sort of changed the conversation quite a bit. We also ended up working and collaborating with the Georgia Department of Public Health, which has its own project called Say Yes Summer Series, and they're going around the state of Georgia. So again, we're all demonstrating here in Atlanta and around the state of Georgia that these collaborations can work, and they do work, I believe.
Louise, thank you for bringing up the Georgia Public Health Department program, and also just applaud your initiative to get all of us, including those of us in government, to get off the dime on this. So thank you for that. Seriously. Let's just, Monica and Anna, I guess I'd love to hear sort of what is being part of this partnership mean to your organization. And I guess we could take it from two perspectives, right? Monica from the organizational standpoint, and Anna as one of the people in the trenches, a curator doing this work. Are there particular benefits or ways in which your work has been strengthened by this partnership? Monica or Anna?
I'll let you start, Monica.
So for us, we are an organization that is constantly, we're very aware of what's happening in the world, in our communities, in our cities, and we know that we have a responsibility to say something and not ever stay silent. And when COVID happened, one of the biggest things that we saw was that this was affecting our artists, especially because we work with a lot of artists of color, not just in the sense that they were getting sick and the fear of, their family members getting sick, but the fact that they were also losing jobs. Artists, a lot of them don't have the privilege to say that their craft is their full-time job. And so we saw artists getting affected in different ways. So immediately we took it upon ourselves to create this project, Signs of Solidarity, and create mini grants for our artists. I hope that our reaction, even though we're just a public art organization, but we want to take on social issues, inspires other organizations to also see that if we are going to offer support to our artists, this has to come in the way of financial support, in the way that we have to worry about them not having health insurance, and see all of the struggles that it means, what it means to be an artist, because it's not easy. So Signs of Solidarity is the project that we're doing today, that we did this time around with CDC, is just the continuation of what we started at last year. Last year, we gave mini grants to artists to create these banners with messages of hope and positivity, and sort of a love letter to our community that we're all in this together. And now we are here encouraging our community to go get vaccinated. So it's kind of like the second part. This time around, we didn't want to do it on our own. And we wanted to bring Anna here, who is a local curator, to take on her perspective. And also, to teach us something else, because she's working with artists that we didn't know. So yeah, Anna, if you want to take it from here.
Sure. So when Monica asked me to take on this project, I was really excited, especially with the subject matter being around vaccines and bringing awareness to that. So essentially, when I reached out to all of these artists, I really wanted to allow them the opportunity to create original works that kind of showcase human connection through community engagement. So kind of asking them like what life, after COVID, post-quarantine, with access to the vaccine looked like to them, and like what its importance was to them, whether it be being able to, go back to work, or interact with their friends or family members. So it was really great being able to work with these 9 different artists. All of them were Latinx or African American, Black, artists of color. And so that also was really important in choosing them because the areas that we were kind of targeting were those. So yeah, it was really great. It was also really great interacting with the different businesses that we hung the banners at, and seeing them so supportive and yeah.
And I just to follow up with you there, does this really stretch your own kind of capacity as to what you, or your own training as a curator or your own skills? Like, was it a real push to do these other tasks or to extend in this manner as part of the organization, or what's your sense of the growth capacity there?
Yeah, it definitely was a different experience for me, especially having to work with the businesses. I typically only work directly with the artists. So it was really interesting being able to have the opportunity to work with these other businesses that also kind of, their lives were affected by COVID just as much as these artists' lives were affected by COVID. So it was really great to kind of see that community come together, and yeah.
That's great. Yeah, Monica, you couldn't see, I don't seem to have my reactions panel for Zoom, but I would have put a thumbs up when you were talking about the need for obviously supporting the artists and making sure that, their capacities or their needs are met throughout this and not leaning too heavily without that kind of support on artists. So thank you very much. Jide, your organization, Hip Hop Public Health, represents a deep integration of public health and the arts. In fact, it's, I understand, a collective of artists, public health professionals, and others who, and I'm going to tap into your mission statement here, who, quoting it, who deliver positive health behavior change through the transformative power of music, art, and science. And I just have to say, your career really seems to embody that nexus really nicely as a neurologist also. Can you talk a little bit about what types of transformation you mean and what you see taking place? What does success look like when you talk about transformation through the arts in terms of public health and health communication strategies?
Sure, thanks for that, Sunil. So Hip Hop Public Health, we believe that human behavior flows from 3 main sources: from desire, from emotion, and from knowledge. We believe that persuasion occurs when 3 components converge: it's credibility, logic or scientific evidence, and the act of appealing to a person's emotions. When these 3 things come together, when the art of appealing to people's emotions through music and culture ignites public health information presented by credible hip hop messengers, we believe a meaningful experience is created, one in which we can learn something, we can feel something, and in a way that makes us want to do something. In our case, we leverage music, which, as a neurologist, we know that music has very powerful effects on brain circuitry. Music has a way of softening resistance to messages we may not want to hear. It can enhance learning, it can enhance mood, it can enhance memory. We even use music therapeutically in our hospitals with our patients. Music can motivate behaviors. And so we decided to test this hypothesis in an NIH-funded clinical trial that showed that those who were exposed to our hip hop stroke intervention were more likely to act when they were witnessing a real world stroke by recognizing the symptoms that were taught through the music and calling 911 despite the adrenaline and fear of that paralyzing moment where you're watching someone have a stroke. Music was able to break through that and engage that individual in the knowledge that was delivered through our approach in a way that we have seen 911 called for numerous family members of our participants in the midst of a real stroke, compared to a control group. And so we've seen music save lives. And that's what we mean when we say the powerful, transformative power of music.
Thank you, Jide. And this gives me an opportunity to also to note, as you did implicitly, that the National Institutes of Health and other federal agencies has definitely been investing in research about, in this case, music and health benefits, including those that involve public health. And it's been really great to be able to partner with them in supporting some of those kinds of research under research grants under an initiative called Sound Health. Thank you all. Deborah, let's go to you. So as you know, as you kind of exemplify, I think there's been some innovative developments related to COVID-19 response in the state of California over the past year. We'd love it if you could tell us about both the California Creative Core and the San Francisco Creative Core, and how these models might be replicated perhaps in other parts of the country.
Yeah, great. And so inspiring to hear from all of you. I'm humbled to be here. So as was mentioned, I had the honor of serving on Governor Newsom's Jobs and Business Recovery Task Force. At the same time, I was serving on San Francisco Mayor Breed's Economic Recovery Task Force. And those two things enabled me to really bring into the conversation the evidence that we have, that in crisis, it is artists who shift hearts and minds. It is artists who meet people where they are. And I think artists understand that we have to build trust and we need to comprehend our interdependence, right? And so there was a moment in California where, early in the pandemic, where there was a spike. We were having issues with people wearing masks. We were wanting to help build that trust and meet people where they were. And I was able to actually point to the evidence and the research from the University of Florida School for Arts and Medicine, directly point Governor Newsom to that information. And that really caught his attention. It stopped the meeting. And I should point out that I was, as far as I know, the only arts person and one of the very few nonprofit people that were serving on that particular task force. And so it was work to try to bring these concepts of the role of the arts and the impact that artists can have into a conversation that was focused quite a bit on business and jobs, right? And so connecting the dots around artists are one of the most powerful resources in the state of California. They are intensively underrealized, underutilized, and they have transformational impact every day, one neighborhood, one block, one classroom at a time. And if we just invested in that ecosystem and thought about artists as essential workers who can meet people where they are, who can spread health messages, who can bring joy into public life again, that it doesn't have to be about making people feel bad. It can be about helping people feel connected. So we were able to do two things. And one was to collaborate with San Francisco's Office of Economic and Workforce Development to pilot the San Francisco Creative Core. And this was very much about working with performing artists and visual artists, again, meeting people where they were, employing artists to help spread those health messages, to help people feel that they are interdependent, that we can take care of ourselves and of one another. So picture 100 murals, an organization called Paint the Void, in a very short period of time throughout the city of San Francisco. Most of these murals, highly collaborative projects, artists working with community members, really rooting in the context of the neighborhood. And picture musicians and stilt walkers, performers on the streets in places where we had a lot of gathering and not a lot of mask wearing. And what we found was that people responded. People responded in particular to the very contextually oriented work that the artists were coming from and were in and with the communities. And then we were able to bring that story back to Governor Newsom and his team. And he has since put $60 million in California's budget for a 3-year pilot creative corps, and working with others in the state of California, including Californians for the Arts. We're also working together on, well, Californians for the Arts is leading on a bill that would assure that this is also about workforce development. This is about the creative workers in the state of California. It's not just a discrete project in response to a crisis. And the last thing that I'll say on that is that one of the things that was really moving to me, in particular with Governor Newsom and of course Mayor Breed, is that they understand that it is not about using the artists right now because we're in a crisis. In fact, they understand that artists will help us understand these times. They will document and help us understand the consequences of what we've been through. And that is extremely important. What is the narrative of this time? And how can artists help us move from this to something better? So to me, it's really important that as we think about replicating or collaborating across the country, that this is not about a discrete moment. This is about the essential role that we all know that artists play in moving us forward as a society.
Thank you, Deborah. Jide, I saw you nodding vigorously, and I guess I would ask, do you want to comment on maybe the more enduring role or potential of working with artists and arts workers in the public health space, since you come from, and I think of you as steeped, part of you is very much steeped in well, certainly in science, but in medical field. And so do you see a more enduring benefit of working with artists? And I mean, I know that may seem like a leading question, but can you speak a little bit about
Sunil,
that?
it's I was really nodding vigorously to Deborah's comments because it connected so intensely with what I believe and what we believe at Hip Hop Public Health. You know, if you look at how we, one of my great frustrations is health disparities. It's our failure to communicate with the deep structures within certain communities that are suffering the most. We usually just, cobble together different initiatives, but we're only appealing to those superficial structures. To appeal to the deep structures within these communities, we need to understand the nuances of their culture. We need to be able to connect with them through their credible messages, through their art. Art is an intricate part of life. And so I truly believe that public health communication, especially when we're communicating to communities that might be marginalized and have lower literacy levels because of the marginalization, et cetera, and structural racism, certain communities are already distrustful of messaging. And the way to break through is to partner with the resources within those communities. And these communities have incredibly rich resources. Hip hop was born in the Bronx, in the South Bronx. We have, some of our artists are actually pioneers. I mean, one of the original hip hop groups is called the Cold Crush Brothers. For all you hip hop connoisseurs out there, Cold Crush. If you remember Rapper's Delight, well, that Rapper's Delight, actually, the original verse was written by a guy called Grandmaster Caz. And Grandmaster Caz is one of the lead MC for the Cold Crush Brothers. And they're one of the groups that started hip hop in the Bronx. And one of the members is part of Hip Hop Public Health. And we were always talking. And he always says, look, if you want to reach folks living in these communities, you have to do it through their language. You have to do it through their art. You have to do it through their culture. And we public health and physicians like myself, we kind of sit over here and the community sits over there. And we've never fully been able to bridge that gap in a way that's experiential. And what Hip Hop Public Health is trying to do is create that experience, not a lecture, not a lesson, but an experience. And to do that, we have to make a paradigm shift and embrace the arts.
It's wonderful to hear. Thank you very much. I know we only have a few minutes left. I just wanted to, if I could, toss this out to Louise, Monica, and Anna, and you can respond however you'd like. But I'll try to fuse two ideas. One is, I think some of us were talking before this panel, and we realized, okay, artists, of course, are not monolithic either, right? I mean, there are very different kinds of motivations for artists and what they do and how they serve society and what their goals are. But also they have different views toward the vaccine, and I don't know, maybe this is more, in the near term for Living Walls, for you, Monica and Anna, but have you dealt with vaccine distrust among artists, and how is that how have you tried to overcome that through your work?
Yes. So initially, when I originally started reaching out to the 9 artists for this project, I had quite a few that were either busy because they had other projects, but I did have a couple that were hesitant to take on the project because their viewpoints didn't line up with the project's viewpoints. And so I did come across a couple artists that did not want to take part because of that. And, really all you can do is just kind of accept and, move on to the next. But there definitely was some distrust.
Yeah. Were you going to say something, Monica, or is that?
No.
Okay.
Yeah, there's definitely a few artists that I know that they don't necessarily trust the vaccine. And to be honest, I get it. I understand it. There's been so many different experiments done on people of color that I get it. I think the goal with this project was to create and inspire trust, and we're not trying to say we're better or we're right and you're not. And hopefully, as we all continue to gather our community and get more support, maybe we will be able to convince one or two. And during this project, actually, we also had mobile vaccinations happening at 3 events. And the second to last event that we had, the girl that was working the event at this restaurant, her mother had actually had COVID, and we were there in support of the mother and the business. And this young girl tells me, I don't have the vaccine, but we're here doing this whole project with her. And it was kind of amazing that she had not been vaccinated. And so with our project, she went and got the vaccine. And that was kind of like a huge win for us, right? Like if we were able to convince one person with this project, then that's one life.
I keep coming back to something my colleague Rod Joyce said at the outset about trust being the currency of public health, and I think this really this comes around so many times, especially even with those participating in these projects, as you say. So thank you. That issue, Louise. I think we have like maybe just 1 minute, but I did want to ask you this, and hope it's not unfair to ask you a fairly big question or general question. But I'm hoping that out there are a lot of cultural policymakers, funders, maybe researchers who want to get involved in this kind of work and haven't forged these kinds of collaborations or want to partner if they're artists with public health or vice versa. Are there any kind of general rules of the road or advice you'd give about these kinds of cross-sectoral partnerships, particularly here in the arts and public health, around health communications, or maybe any minefields you would steer people away from?
Right. Well, I have worked both as in the art realm and in the public health realm at this point in my career, and they have different cultures, and you have to reconcile the different cultures in how you measure success and what is considered evidence. And that's one of the reasons why we did these pilot projects here, and there will be an opportunity, like a post-mortem, so to speak, of how the communications went, what was our success, what would we have done differently, what went really well. And I think that whenever you do any kinds of collaborations, no matter who the collaborators are, you have to sit at the table and really define what's in it for you, what are your motivations, and see how you can reconcile the different kind of cultures, because the culture of public health, whether it's a local health department or the Centers for Disease Control and Prevention, and grassroots arts organizations or even city organizations can be very different, but they can come together, I'm convinced.
Thank you very much. Well, with that, I just wanted to thank you all very much, Louise, Monica, Anna, Jide, and Deborah. We're going to hear in a moment about some public resources and tools that are available to practitioners and policymakers in the space. To talk about this, I'll be inviting Jill Sankey, whom we've already referenced once. Jill and her work seem to have popped up everywhere in the last year as we take stock of arts strategies and public health communications. In addition to helming the Center for Arts and Medicine at the University of Florida, she's a subject matter expert and senior advisor to the CDC Vaccine Confidence Team on the COVID-19 Task Force, and is the lead author of the field guides she'll be discussing. Jill is joined by Catherine Zilber, Associate VP for Infectious Disease Programs at the CDC Foundation. So Jill and Catherine, who wants to go first?
Thank you so much, Sunil. I'll be happy to share the guides and then turn it over to Catherine for the grand finale today. I'm really excited to share the recent release of 2 CDC evidence-based guides entitled Engaging Arts and Culture for Vaccine Confidence. These guides are designed to drive partnerships like we've heard about today between local health departments, public health professionals, artists, and culture bearers and communities to drive vaccine confidence and demand right now in response to COVID-19 and in the future in regard to other vaccinations. So there's a quick start guide for building sustainable partnership that provides guidance and resources on how to engage these kinds of cross-sector collaborations. This guide articulates what it is about the arts and culture that contributes to health communication and shares examples of really great promising practices and step-by-step how-tos for finding partners and building these kinds of partnerships. Then the guide for building programs and creative campaigns is designed to help public health professionals partner with local artists and culture bearers to create culturally responsive and sustaining vaccine education materials and programs. So again, this guide includes really practical step-by-step information on how to design, implement, and evaluate programs, as well as an array of examples and resources. And the CDC also partnered with the University of Florida Center for Arts and Medicine to create the Vaccine Arts Response Repository. So this open access, free online repository features projects and programs and media that again provide powerful examples and resources for creating these kinds of partnerships and programs. And you can add your program to it as well as searching for other programs. And before I turn the mic over to Catherine, I want to acknowledge Natalie Rella for her leadership in building the repository, and also thank the members of the Center for Arts and Medicine's Interdisciplinary Research Lab for their work in supporting both the repository and the guides. And of course, to thank the CDC for thinking out of the box at this moment and driving more public health and arts partnerships to protect all of our health today. Thank you, Sunil and Catherine.
Thank you. Good afternoon. I really appreciate this opportunity to tell you a little bit about the CDC Foundation's expanding grants program to support community-based organizations' efforts to promote COVID-19 vaccination. To date, the CDC Foundation has already committed more than $30 million to over 150 community-based organizations throughout the United States to promote COVID vaccination and to reduce the disease burden. And now with the Delta variant, the role of community-based organizations has never been more crucial. And that's why the federal government and the philanthropic community, private sector, and our public health system are working together to help provide support for ongoing efforts of local partners. And the CDC Foundation is very pleased to join this collaboration with CDC, the National Endowment of the Arts, and the Center for Arts and Medicine to engage the arts community. And I'm excited to announce that we're launching a new $2.1 million grants initiative this month. The opportunity will provide federal funding and support to the arts community to expand the use of arts and culture-based approaches to increase vaccine confidence and uptake. We're looking to fund a wide variety of impactful activities using dance, music, visual arts, theater, and so much more. So the CDC Foundation plans to release this call for proposals by the end of this month. So if your organization is interested in learning more or applying for funding, I encourage you to visit our website, cdcfoundation.org. And I'll just end by expressing my appreciation for all the creative and innovative ways that the arts community is helping keep people safer and healthier during this pandemic. Thank you.
Thank you, Catherine. And I certainly hope people stayed on till the very end to hear that lovely announcement about funding opportunities. Really glad to put that out there. So I want to just end by, again, thanking Jill and Catherine, of course, but thank you all who've participated today. And thank the panelists we've spoken about earlier, Louise, Monica, Anna, Jide, and Deborah, Dakota, Dimitri, Ra, and Natalie Rella, of course, and all of you for, as I said, for taking part. I encourage you all to look for links actually in the chat section, links and resources that Natalie's been faithfully planting there, and to stay connected with each other and to the work of this great task force. Thank you very much. Have a great day.